Hello, my name is Nath Arwa, your antimicrobial steward. I would like to briefly present on the topic, be smart about antibiotics. Now, as a way of introduction, I would like to make a few comments. Now, taking antibiotics when we do not require them, when they are not needed or indicated, is like leaving lights of a battery-driven lamp on all the time. Such lights may burn out, leaving us or leaving you in the dark when you need them the most. Now, if you use antibiotics when you do not need them, they may not work when you fall sick and need them the most. Now, antibiotics can help our bodies fight infections caused by germs, cold bacteria, but they are not miracle or wonder drugs for every infection. Antibiotics are ineffective in viral infections, which include common colds and other upper respiratory tract infections. Now, antibiotics are worthless in self-limiting infections, in self-limiting bacterial infections, which are normally combated by our own immune responses. Our bodies should ideally mount immunologic response in self-limiting infections to contain them. So you don't need antibiotics in such situations. Now, next I would like to comment about situations when antibiotics are not needed. Now, you don't need antibiotics in infections caused by viruses such as the common cold, the majority of bronchitis cases, the flu, and most self-limiting types of diarrhea. Now, we also don't need antibiotics when we have conditions that may mimic infection, such as some kind of anemia and similar medical conditions. Now, we also don't require antibiotics when we are not actually sick. We should avoid unnecessary prophylactic use of antibiotics where the benefits do not outweigh the risks. Apart from that, we should be cautious in the very critically ill patients that are nearing or approaching the end of life, the terminally ill patients. At times, antibiotics may not add value to the final outcome when the prognosis is poor. So we should weigh the benefits and risks before embarking on continuing antimicrobial therapy in such cases. Apart from that, I would like to briefly comment about why doctors give or prescribe antibiotics when they are not needed. Now, doctors at times do not have a clear diagnosis. They can be uncertain of the diagnosis of the disease they are managing. And if such patients are critically ill or fast deteriorating, they may be driven by pressure to prescribe antibiotics even where they are not necessary. And at times, we the patients and the family members and caregivers may also unnecessarily exert pressure on the doctors to prescribe antibiotics. We may think we are not getting quality for our money. We are not getting good care unless antibiotics are prescribed. And in most cases, such caregivers or parents insist on antibiotics being prescribed for their patients even where they are not indicated. So let's try and avoid that. So next, I would like to comment about what you and I can do to reduce this tide that we are facing today. Yeah, so let's talk to or with our doctors about the benefits and the harms of administering or taking antibiotics. Now let's endeavor to take these antibiotics exactly as prescribed by our doctors. So let's avoid skipping doses, because in most cases antibiotics are prescribed for specific durations, and this is not optional. Let's avoid inappropriate use of these antibiotics. Apart from that, we can take care of ourselves when we fall sick by getting quality bed rest, eating healthy, hydrating effectively through drinking of fluids, and there are times when over-the-counter medications can also help with symptomatic relief when indicated. Now, if a patient is a candidate for a hospice, or when we are thinking of transferring them to a hospice, we need to discuss with our doctors whether there is need to continue administering antibiotics. Now, what shouldn't we do? I would like to respond to that question. Now, as responsible individuals, we should not ask for antibiotics when our doctors say, recommend, or strongly feel they are not necessary. Let's avoid exerting unnecessary pressure on our doctors. And we should not take antibiotics for viral infections such as the common cold, most coughs, or flu. Now, most of these are viral in nature, etiology, and antibiotics don't add value in their management, unless, of course, you are dealing with a secondary infection after the primary viral infection. Apart from that, we need to appreciate that antibiotics are not benign, they are not harmless, they can have side effects, they can cause harm. Antibiotics are intended to kill bacteria. Now, sometimes when we take them, not all the germs or bacteria are killed. The strongest ones can survive, multiply or proliferate, and linger around, and they may cause difficult to treat infections in future. Now, when such a person gets sick in future, this time round it may be difficult to kill the germs or to kill the bacteria because of resistance that has emerged. That is to say, such antibiotics may no longer work for such an individual. Now, this phenomenon is referred to as antimicrobial or antibacterial resistance. Now, such resistance can make patients sicker longer. They may require more doctor visits, and they may require drugs that are stronger. Now, these stronger or second and third line antibiotics tend to cost more, and they tend to exhibit more side effects, more toxicity. So let's avoid them if we can through responsible use of antibiotics. Now, the more often we use an antibiotic, the greater the chance that the germs will become resistant to it because of what I've explained in the previous slide. So next, I would like to answer the question, how can antibiotics hurt you and me as their users? Now, antibiotics can save lives, but they can also cause problems too. The older population especially are vulnerable. They tend to have more side effects, and this can negatively impact on their quality of life and clinical outcomes. In addition to the antimicrobial resistance, antibiotics can cause nausea, vomiting, diarrhea, dizziness, skin rashes, kidney damage in extreme cases, and drastic allergic reactions such as anaphylaxis that can complicate treatment, that can merit admission in critical care areas, and that would of course drive cost upwards. So lastly, I would like to urge us not to take antibiotics for granted. These finite resources can be helpful, but now we all know from my brief presentation why sometimes our family members may not need them, for example in viral infections. So let's avoid self-medication using antibiotics. We can help ourselves and others by taking antibiotics only when they are needed in bacterial infections, for the appropriate durations of therapy as prescribed by our doctors. And let us be good stewards of these finite resources, which are becoming less and less effective by the day. Now, this is majorly driven by our irresponsible behavior when we use them in treatment. I would urge all of you to be good stewards of this finite. So, dear listeners, if this video helped you in any way, make sure you give it a thumbs up and subscribe to my YouTube channel. The best is yet to come. Thank you very much for your attention and for watching, and have great antimicrobial stewardship. Thank you.